The views and opinions expressed by the host do not necessarily state or reflect those of the hospital and its management. Furthermore, the views and opinions of the guests do not reflect those of the host, the show, the management, and the hospital. Lastly, no copyright infringement intended. All materials used and music background credit to the owner for public service purposes only.
The VSMNC Sub-National Laboratory registers the following today, Friday, 14th day of August 2020. Central Visayas has 525 samples today. Out of 525, 25 samples are positive and 500 samples are negative. 53,309 samples are tested since SNL started operations. A total of 9,963 positive samples and 43,287 negative samples are registered in Sub-National Laboratory. The results are based on tested samples. The Department of Health Regional Centers for Health Development shall issue the detailed results for positive or negative cases. Thank you.
Here are the latest updates on COVID-19 in our institution as of Friday, August 14, 2020. Vicente Sotto Memorial Medical Center registered the following: a total of 1,006 confirmed COVID-19 positive patients. 409 COVID-19 patients have recovered. 325 COVID-19 related deaths from different geographic origins, and 409 COVID-19 patients transferred to isolation centers. Currently, we still have 20 admitted COVID-19 positive patients. For the VSMMC bed utilization, we have a total regular bed capacity of 865 beds, and currently we have 459 patients, giving us a utilization rate of 53.1%. Of these, we have 185 expanded COVID-19 beds, and currently we have 20 patients admitted. This gives us a 10.8% utilization rate. In VSMMC, we have a 55 ICU bed capacity, and currently we have 10 patients admitted. This gives us a utilization rate of 18.2%. Of these, 24 beds are dedicated for COVID-19 ICU, and currently we have 6 patients admitted. This gives us a utilization rate of 25%. Thank you very much.
It's a Friday. Welcome to Sotto Live Reports. The Institute for Solidarity in Asia, ISA, conducted the strategic review with VSMMC through the Office of Strategy Management. ISA is a non-profit organization committed to transforming the public sector. Through their work, ISA aims to build the shared vision of a dream Philippines, where every government institution delivers and every citizen participates and prospers. ISA works closely with the national government, agencies, local government units, and hospitals to spur growth in the country. ISA findings on VSMNC performance governance system include the following: on personnel, low number of COVID-19 cases and no mortality. The morale of the staff is high because they are aware that the hospital is taking care of everyone, like provision of PPEs, food, and accommodation. The strategic positioning of the hospital is still relevant. The deliverables are a little delayed, but there is progress. It is crucial that the specialty centers that the hospital included in the strategy, which is the infectious disease center and the medical school, because of health crisis. The deliverable for infectious disease is still aligned, but will have to change the timeline. ISA added, the VSMC already has incident command system prior to the Department of Health memorandum. Each plans of the hospital are proactive and there are several contingency plans. In conclusion, ISA noted that the VSMMC is holding up well comparing to other hospitals because of proper management and leadership.
COVID-19 surveillance update of VSMMC on the 33rd morbidity week from August 9 to 15. A total of 1,441 cumulative COVID-19 cases with 324 deaths were recorded in VSMMC for the period of March 11 to August 12, 2020, with the number of COVID-19 admissions this week consistently decreasing from 20 patients to 16 patients. We begin planning activities to resume patient services and elective surgeries once infection prevention control guidelines are in place and clearance from the proper authorities to do so is obtained, while maintaining vigilant with emergency preparedness in case of another surge of COVID-related admissions. Ages of cases range from 1 day old to 92 years old with a median of 39 years old, mostly affecting those between 31 and 40 years old. Most were females. Majority of the cases were from Cebu City, Cebu, followed by Mandaue City, Cebu, Lapu-Lapu City, Cebu, Talisay City, Cebu, and Consolacion, Cebu. Cumulatively, VSMMC had a total of 324 deaths. Up to 68% died as dead on arrival, ER death, and death less than 48 hours. This can translate to delays in patient consultation for symptoms experienced or downplaying the symptoms until too late. Ages of mortality cases range from 1 day old to 91 years old, mostly affecting those between 61 and above years old, with a median age of 57 years old. Most of the cases were male.
On walk-through and drive-through, Vicente Sotto Memorial Medical Center VSMMC launched the drive-through and walk-through swabbing for RT-PCR for SARS-CoV-2 COVID-19 last July 24, 2020 Friday. This is a program of VSMMC Subnational Laboratory, SNL, in line with the expanding testing guidelines for Department of Health Memorandum 2020-025SA. VSMMC invites the stakeholders to register online, and this is free of charge. Dr. Reynette Ligaray, head of VSMC Subnational Laboratory, said that results shall be available via email in 2 to 4 days. For free online registration and scheduling, click the link https://bit.ly/VSMMC online. VSMMC reminds the public that due to voluminous registrations, there are times that the link is not accessible. However, VSMMC encourages to retry or contact the medical center through the official Facebook page. As of today, VSMMC SNL reports drive-through has a total of 746 swab patients, walk-through has 565 swab patients, plus 1,384 for all employees. VSMMC urges the clients to come on registered schedule. Thank you.
As a result of our ramped-up COVID-19 testing, the positivity rate is the percentage of people who test positive for the virus over all of those who have been tested. As part of the trends of the COVID-19 epidemiologic curve, the positivity rate is one of the parameters for declaring the quarantine level of a community. Based on the respiratory samples tested for SARS-CoV-2 by the RT-PCR in VSMMC Subnational Laboratory, the positivity rate has decreased from 38.76% in June 1 to 30, 2020 to 1.67% in August 1 to 12, 2020.
On the report on dialysis, the patients in need for dialysis could register at VSMMC to avail of these hemodialysis sessions in the VSMMC Dialysis Center Satellite and SMC site. Dr. Gerardo Aquino Jr., the Medical Center Chief of Vicente Sotto Memorial Medical Center, said that those old or regular patients of VSMC Renal Center shall have the access of the facility. For the new patients, they have to register in VSMC first. One requirement prior to availing of services is a swab test for COVID-19. VSMMC offers free swab tests to the patients. Today, at 1:30 p.m. A ceremony took place for blessing of the dialysis center in Seaside City by Monsignor Angcahas, Dr. Aquino, Dr. Ariel Indo, Head of VSMC Renal Unit, and Mr. Mark Franco Valencia, VSMC Chief Nurse, attended the event with Secretary Michael Lloyd Dino of the Office of the Presidential Assistant of the Visayas, Governor Gwen Garcia of the Province of Cebu, Mayor Edgardo Labella of the City of Cebu, Mr. Felix Tagia, President of Cebu City Chamber of Commerce and Industry, and Ms. Maria Eloisa N. Fernan of the SM Prime Holdings. Aquino said that the satellite VSMMC Dialysis Center has 15 dialysis machines and can attend to non-COVID patients. Once the results of the water analysis is out, full operation shall start.
On universal healthcare and the healthcare provider network. During the latest DOH teleconference with hospitals, the Department of Health emphasized the provision of universal healthcare, which is all about service coverage with immediate eligibility and access, comprehensive outpatient benefit, and provision of primary health care. The Healthcare Provider Network is a group of health facilities providing a comprehensive primary to tertiary level of care. A complete healthcare provider network shall be composed of primary services from primary care facilities, an infirmary, a level 2 hospital, and an apex hospital, which is level 3. As per definition in the law, apex hospital are level 3 DOH hospitals. Level 3 hospitals offer departmentalized and specialty services. These services are rarely available in lower level facilities. The apex hospital or the end referral hospital in Cebu Province is Vicente Sotto Memorial Medical Center. In order not to exhaust resources and decongest higher level of care, each individual or family shall strictly follow a predetermined patient pathway. This is to ensure that patients are designated to be in primary care settings will remain there, and only cases which need higher level interventions will proceed to higher level facilities. However, the patient pathway for patients tagged as sick emergency is different. This is a special case wherein they are allowed to be brought directly to either the provincial hospital or directly to the apex hospital should it be deemed necessary. The Central Visayas Electronic Health Referral System is an online and real-time web-based electronic referral system with most of the hospitals in Cebu registered into the system, a best practice in Region 7. The DOH Central Visayas has launched its new 711 Emergency 24/7 Health Line to respond to health emergencies, navigate patients, facilities, and the community in accessing appropriate health services, ensure availability of an updated hospital and TTMF bed tracker, respond to health-related inquiries, dispatch ambulance for COVID-19 transport and referrals, thanks to RAFI and Riavo partnership, and to coordinate with stakeholder LGUs and NGOs. This will strengthen the use of our online referral system for improved patient safety.
On the National Hospital Week report, VSMMC celebrates this year's National Hospital Week with the theme Hospitals as Champion in People-Centered Care in the Fight Against COVID-19, led by the Nursing Service Division. VSMMC elaborates an immense respite to the hospital staff. This reflects the satisfaction and compelling spirit of the hospital's continuous commitment in battling the challenges of COVID-19 pandemic. Swerving through the unpredictable nature of the pandemic relays the great stronghold of Vicente Sotto Memorial Medical Center. It portrays for the cooperation and strong commitment of the different working entities and its interplay within and outside the hospital. VSMC, an unwavering fire of commitment and dedication, trust this movement to evade that the obstacles brought forth by this pandemic. Hospital employees continue to ignite the burning flame and illuminate our ways among ourselves. VSMC, an institution of excellent care, workers with true idealism of genuine public service, kindness, and compassion must resonate to ease the hardship of the Filipino. The activity commemorates the heroism of our hospital employees. This week-long celebration is full of activities and showcases. VSMMC talents in TikTok, extemporaneous speaking, slogan making, and spoken word poetry. Winners were announced yesterday in Sotto Natin To. Special episode. Dr. Gerardo M. Aquino Jr. handed the plaque of appreciation to Secretary Michael Lloyd Dino for his unconditional support and commitment given to the Vicente Sotto Memorial Medical Center. Right, there you have it, ladies and gentlemen, the special video for the related to the National Hospital Week. Okay, so at this point, we would like also to show to public the results of our drive-through, walk-through, online satisfaction survey so that we can serve you more or better. Out of 72 responses of our drive-through, walk-through, we have this as a breakdown. 65.3% is on the drive-through and 34.7% is walk-through. And on the question, can you do it, Dr. Helen?
Yeah, paspas ug sayon ang proseso sa pagrehistro. The registration process is quick and easy. 71 or 98% place the smiley face.
Good. So, and the second one is hapsay ug paspas ang proseso sa testing. The process of the testing is quick and organized. Out of 72, 100%, 72 responded yes or happy face.
Yeah, so I find the program helpful. 100% agree.
And on the overall, I am satisfied with this program. Out of 72, 100% also said happy face.
Okay, so would you recommend this program to your friends and family? 98.6% said yes.
Right? So it's good also to check the comments or the suggestions of our clients with the drive-through, walk-through program. So we have here very nice Cebu City, and you are doing great. Continue your service and God bless you all.
So the guy who took my swab sample was so friendly and was very gentle. Good job, guys. Hopefully, this will end soon.
Ang naka-attach nga result kay di maklaro, black ang color. Other than this, okay ratanan. Thank you, BSMMC.
So this is a very helpful initiative and I'm grateful to have availed it. However, please restructure your result email. Having the words, please stay at home, as the first thing you read in the email is misleading and may cause panic to some. It would be best to start with a thank you for availing of the swab test, followed by letting the patient know that the attached in the email is their lab result. Next to that, a short awareness of COVID-19 would also be helpful, followed by instructions on what to do in case of a positive result.
Salamat sa programa, maayo unta ug naapay opportunity nga makapatest ang kadaghanan.
Okay, so very satisfactory. It is very helpful to me to get to know if I am infected with the virus pandemic and to those who can't afford to pay for testing.
Absolutely great program. The program is very helpful and medical staff is very efficient and polite. Keep it up.
So open more slots per day because a lot of people want to be tested and avail of the free testing. I gather that a lot also avail of appointments but don't show up. It's a waste and pity for the others who really need to get tested ASAP. There should be an allocation for non-show up. By now, na-trend na ang show-ups versus no-show para dili long ang wait sa mga gusto matested.
Daghan salamat sa programa. Praying for more recoveries and we will heal together. God bless the frontliners.
Okay, so keep up the good work. Salamat. Awesome. Keep up the good work.
Great program. I hope more people will have themselves tested. Very good.
Okay.
The service was quick, easy, available, and convenient. I like that thought that I don't have to get down and have the test. The frontliner also was very attentive and careful in handling the patient. Please be safe.
Okay. Ipadayon ang kahapsay, nakatabang jud kaayo siya ug dako nako. Keep the good work, Vicente Sotto team. At first, nagduha-duha gyud ko magpa-test tungod sa mga storya nga dili lagi daw safe magpa-test sa inyong hospital. But sa dihang nakakita ko sa FB Live ninyo, tanan na kong duha-duha inyong natubag. Dili nako makalimtan kay pag-abot nako anha, grabe akong kulba with hashtag dako akong pray sa Ginoo nga negative lang taon ang test. I'm so amazed tungod kay gikan sa guard until sa swab area nindot kayo ang inyong pag-approach. Thank you, Vicente. Sorry team, bisan sa kakapoy ninyo na arag gihapon, inyong energetic nga smile, and thank you also sa nag-swab na ko, even though wala ko kailan nimo, sir, saludo ko nimo. Again, keep the good work, Vicente Sotto team. God bless always.
And thank you for the swab testing. It gives so much peace of mind being aware of our health. And thank you for a hassle-free swab testing. Thanks so much, frontliners.
Okay, the procedure was very organized and we were satisfied of the service. This program helps a lot. Thank you very much and keep safe.
And of course, very efficient. They make sure the flow was smooth and that it's strictly first come, first serve basis. Thank you so much.
Overall, kay nasatisfied ako sa service. Luoy lang kaayo ato frontliners kay inginit kaayo ang lugar niya naka full PPE gear. I hope makabuhat mog small tent nga naay aircon para nila. Thank you and God bless.
Very satisfied, thankful for this service or free and fast swab result. This is very helpful to the community. Very good and thank you for the effort DOH. Mabilis, it's okay. It's cleaning testing. So mao kadto, no? We still have more. Is it there? Okay, here. The last part, the procedure, the health workers assigned in the entrance are very helpful and friendly.
Why they do not ask first if I have symptoms like cough or fever before the procedure, but overall, I am oversatisfied, happy of my result, but confused. What if positive? What will I do? How to deliver myself a message that I was staying for a long time of my parents or relatives? Though thanks for the help and God bless us all. Amping mga frontliners, salamat sa support.
Nalipay ko og satisfied sa program ug manghinaot ko nga daghan pa ang madasig magpa-test kay dako kaayo kini og tabang para masumpo na ni ang COVID ug wala nay makalas pa nga kinabuhi. Salamat.
I am satisfied with the service. Good job to all of you. Keep safe and God bless. I am really, really satisfied.
Well organized and executed, this is so convenient and makes me trust VSMC MMC more. Such a brilliant idea. Frontliners are so helpful too.
Okay, so thank you very much for all of your feedback, and we will take into consideration the suggestions that were provided.
Here in Sotto Live Reports, we are happy to hear the feedback and we would like to serve more people. So keep on registering to our
social media platforms. We have Twitter and Facebook. We are at official VSMMC, and on YouTube, our videos are recorded on Vicente Sotto Memorial Medical Center. And if you wish to give us additional feedback, suggestions, or even complaints, you may email us at vsmmc_osm@yahoo.com.
Right. We would like also to thank our medical center chief, the incident commander of the incident command system of VSMC, Dr. Gerardo M. Aquino Jr.
Thank you very much for all of your innovations and keeping up the good work and making sure that things happen.
And special shout out.
Yes, I'd like to shout out to the beautiful men and women of the HIV/AIDS core team at Kaambag Clinic.
Hello, Kaambag Clinic.
Thank you. Thank you for the extra mile that you serve for our patients.
And a happy birthday.
A happy birthday to Dr. Tara Arias of Pharmacy and Dr. Badillas of the Department of Internal Medicine. Happy birthday!
Happy birthday, Dr. Arias and Dr. Badillas of the Department of Internal Medicine. Alright? So, I hope these are you enjoyed the Sotto Live reports tonight. And as the kicker for tonight, surrender to what is, let go of what was, and have faith in what will be.
You have enough, you do enough, you are enough. So relax, take a deep breath, and just enjoy life.
I am Ray Chris Panugaling.
I am Dr. Helen Madamba.
You are watching Sotto Live Reports. Quality service is our pride. Good evening.
Night.